Hi, my name's Amanda. I'm going to be your student nurse today, and I'm going to be performing a head-to-toe assessment. Can you tell me your name and date of birth?
Jordan, 4/23/1996.
And can you tell me today's date?
April 5th, 2016.
And where we are?
University of Detroit Mercy.
And do you have any allergies?
Nope.
And do you have any pain?
No, I do not.
The patient is alert and oriented ×3. Her speech, mood, and affect are all appropriate given the situation. There appears to be no present sign of illness, and her hygiene is well, and there is no odor coming from the patient. First, I'm going to start with inspecting your skull. And the skull is symmetrical. There are no bumps or lesions or cuts. The hair is evenly distributed and is free of parasites. Next, I'm going to feel your face with my hands. The patient's skin is an appropriate color for her ethnicity. It is warm and dry. The patient's nose is midline, and so are the lips are symmetrical, and they are moist, and there are no cracks. Next, I'm going to look at your eyes, and can you just look straight forward? And then can you just follow my pen? Okay. The patient's pupils are equal, reactive, and they both accommodate. And next, I'm going to look at your conjunctiva and your sclera. The conjunctiva is pink and moist, and the sclera is white. Next, I'm going to look at your mouth. If you could open your mouth, please. And say ah.
Ah.
The patient's buccal membranes are moist, pink, and without lesions. The patient's gums are pink, moist, and without edema or bleeding. The patient's teeth are all there. They are white without any evidence of caries or appliances. The patient's tongue is midline, pink, moist, and without any coatings or lesions. And the patient's uvula retracted when she said ah. And the tonsils were a grade 1, which means that there was no lesions or edema. And next, I'm going to feel your carotid pulses. Okay. The carotid pulses are 2+, and they were equal bilaterally. And next, I'm going to assess for bruits. So I'm going to listen with the bell of my stethoscope, and when you feel it, can you just hold your breath? Okay, and there are no signs of bruits. And if you can just turn your head to the side for me, and the other side. And there are no signs of jugular vein distension. And next, I'm going to listen to your heart. I'm going to listen at the aortic, which is on the right side in the second intercostal space. And then I'm going to listen to the pulmonic, which is on the left side in the second intercostal space. And then I will listen to the Erb's point, which is in the third intercostal space, the tricuspid, which is in the fourth intercostal space, and the mitral valve, which is in the fifth intercostal space, and the midclavicular line. So first, I'm going to listen with the diaphragm of my stethoscope. And this is where I would listen to the apical heart rate for 60 seconds. And next, I'm going to go back up, listening with the bell of my stethoscope. And heart sounds were heard in all fields, and there was no presence of any murmurs. And next, I'm going to listen to your lungs. So I'm going to listen to 8 places on the front, 2 on the sides, and then 10 on the back. So when you feel my stethoscope, if you can just take a deep breath. I'm going to listen on your sides. Okay, and now I'm going to listen on your back. Okay, and lung sounds were clear in all fields, and there were no adventitious sounds. Next, I'm going to have you lean over, and I'm going to check your spine. Okay, the patient's spine is straight, and there are no signs of curvature. And I'm going to percuss your costal-vertebral angle, and tell me if there's any pain.
No.
And next, I'm going to check your anteroposterior diameter, which is a 2 to 1. Okay, next I'm going to have you lay down, and I'm going to look at your abdomen. Okay, the patient's abdomen is flat. There's no distension. It is a normal color for her skin tone. There is no lesions or cuts or bruising. So next I'm going to listen to your bowel sounds in all 4 quadrants. Okay, and vowel sounds were heard in all 4 quadrants. Next, I'm going to percuss. And there was dullness in the right upper quadrant where the liver is, but in all other quadrants there was tympany. And now I'm going to palpate and tell me if there's any tenderness or pain. Okay. And in the right lower quadrant, there is the appendix and the cecum. In the right upper quadrant is the liver and the gallbladder. In the left upper quadrant is the stomach and the spleen. And in the left lower quadrant is the descending and sigmoid colon. So next I'm going to look at your arms and legs. So the temperature of your arms is warm, the hair is evenly distributed, the skin is dry and pink, and I'm going to feel your brachial pulses. Your pulses are 2+ and equal bilaterally, and I'm going to feel your radial pulses. And those are also 2+ and they're equal bilaterally. And I'm going to look at your fingernails. And your capillary refill is less than 3 seconds, and can you put your fingers together like this? And there are no signs of clubbing. If you can grip my fingers. The patient's strength is equal bilaterally. And next I'm going to look at your legs. So the patient's skin is warm, dry, and an appropriate color for her skin tone. The hair is evenly distributed. And I'm going to feel your popliteal pulse. And it is a 2+ and is equal bilaterally. And I'm going to feel your tibial pulse. And that is a 2+ and equal bilaterally. And I'm going to feel your dorsalis pedis pulse. And it is a 2+ and equal bilaterally. And there are no signs of swelling or edema in your legs. And I'm going to just run my pen to check up the bottom of your foot to check the Babinski reflex. And that is normal. And I'm going to have you stand up and close your eyes. And this is the Romberg test, and I'm going to have you stand like this for 20 seconds. The patient has no swaying and her balance is good. And can I have you sit back down? And now I'm going to perform the get up and go test. And I'm going to have you stand up, walk to the door, and then come and sit back down. The patient's gait is steady and performed the get up and go test in a good amount of time. And this completes my head to toe assessment.